it's interesting because in your book, you mention like IgG and IgE responses, right? You mentioned the difference between those two tests. And I think that's a thing that, people are trying to be more sophisticated. And the doctor says, we can do a food sensitivity test. And the person goes, yeah, that's great. I'll find out what I'm sensitive to. And they don't realize that there's so many of the wrong kind of tests coming back. So maybe you can talk a little bit about that, like how these food sensitivity, like, first of all, the difference between a food sensitivity and a food allergy, and then the difference between IgG, IgE, and why trying to tie a specific sensitivity to a thing you just ate might not be the accurate way to assess that.
Yeah, I'd be happy to. This is definitely one area in my field where I differ, because there's a lot of practitioners in my field that do order a lot of IgG food panels. Even kind of the people that I trained from did it. What I learned about, I've never ordered one in my career. So I guess that's how I feel about IgG food sensitivity testing. When your body reacts to food, there's three main reactions. So you mentioned IgE, which is an allergy. IgA, which is celiac disease, so it's specific to gluten, or IgG, which is sensitivity. There's main differences. And I always say that allergies and celiac are easy to work with, because the biggest reason why is because the reaction happens almost right after you eat the food. So you don't make it into your 20s or 60s and not know that you're allergic to peanuts. The other thing is, if you're not sure, you can go to your doctor, and there's reliable blood testing, skin testing, and you can diagnose what somebody's allergic to. You do a blood draw and you get a reliable result. IgG antibodies, food sensitivities, are what I work with and what we work with in functional medicine. And what makes them so difficult is that the reaction is delayed hours to days after eating the food. So the example that I always use is, like, I can eat a bagel every day for breakfast and I feel fine. I feel great, but I have chronic migraines. I got depression. My skin's starting to get a rash. My knees are hurting. And I go to my doctor and I get a pill for the headaches. I get a pill for my knee. I get a pill for my gut. I get a pill for the depression. And I keep eating the bagel every day. I'm never going to get better. I'm going to just end up on more and more pills, and I'm going to be a great customer, right? They're going to make a lot of money on me over time, and I'll think that I'm doing the right stuff. So, and you'll never know, like, without, and so the only way, in my opinion, to really diagnose food sensitivities is with a 21-day elimination diet with reintroduction. And so there's a lot of variations. People have said, like, yeah, I've done elimination diet, the Whole30, whatever. The elimination diet is based on science. So everything in your body has a half-life, right? So if you drink alcohol, if you smoke weed, if you take prescription meds, your hormones, lead, mercury, mold, toxins, everything has a different half-life. The half-life of IgG antibodies is about 21 days. So let's say I had that bagel for breakfast this morning and I have 100 IgG antibodies floating around. If I avoid gluten for 21 days, that antibody count will drop in half to 50. So the immune response is cut in half. On day 22, I eat the gluten again. If my body remembers it, my immune system remembers it, it'll attack. And this is probably the kind of gets me to the most important thing about the gut. The inside of your gut is actually considered outside of your body. So the gut is a tube that runs from the mouth to the anus. There's openings on both ends. If you swallow something and poop it out, it's never been in your body. So to me, besides digestion and absorption, the most important role is for your gut to decide, like, hey, this should come in, this should stay out. And that's that term, leaky gut. So when gluten proteins get into the bloodstream through the gut barrier, now it's in the bloodstream, which is now in your body. Where does the bloodstream go? Everywhere, right? From your head to your toes. The blood's going everywhere. It's carrying oxygen. That's why you could take 100 people with a dairy sensitivity or SIBO or dysbiosis or a gluten sensitivity, and everybody has different symptoms. And that is why the gut is the gateway in, like, for disease, health, and it's the gateway into your body. And so when you eat gluten again on day 22, let's say you went into it because of migraines. When your migraines are gone, when you reintroduce gluten, you might get a rash. You could get abdominal symptoms. You might not get the symptoms that you're looking for. That doesn't mean that it's not inflaming your body, which at different times can present differently. So in my experience, an IgG food test is typically just the best test for leaky gut. The majority of people you ask that have done that testing, it's basically a log of what you've been eating for the last 2 to 3 months. And because if you have leaky gut, the gap junctions are open, and then those foods that you're eating frequently are getting into your blood, and your immune system can have this low level response to them. And that shows up on a test. So the way that I've always said that I would use a food sensitivity test if I had a patient who was really resistant to an elimination diet, they won't do it. That either hasn't happened or they haven't come back to me. So I've never ordered one, but I've put thousands of people on an elimination diet.
And I think you mentioned in the book too, that the biggest problem with those food sensitivity tests is they tell you a thing you're sensitive to, but that actually could be more of a reading representing what you've actually eaten versus what you're sensitive to. And so like I did one of those one time and I immediately like my spidey sense went off and was like, something's not right here, because it basically told me I'm sensitive to all the things I'm eating anyways. So like, I don't know how to make out with this information.
I would then look at addressing leaky gut, right? If that's the way someone's test came back, I'd be like, okay, there's something that's making your gap junctions and your gut lining open. And that's why this test is showing up the way it is.
So is it the IgG antibodies that open the tight junctions? Is that what does it?
No, there's a specific protein that they found called zonulin that causes the gap junctions to open. Basically, when those gap junctions open, then the food protein gets into your blood and your immune system attacks it if it thinks it's an invader. That creates the IgG complex.
Interesting. And, you know, one thing I've been thinking about too with food is like the components and chemistry of food, because it's important to note that like if you're eating a bagel and you're eating a bagel every day, everybody's like, well, it's the gluten, but a bagel is also made up of all kinds of other stuff, you know, like bleach in some instances, you know, food coloring, all kinds of chemicals. And it may have even been like the fact that it was subjected to heat at some point that turned those chemicals into problematic factors for you.
Yeah, totally agree.